Hello, thank you for sticking it out through this last session here at SAGES. My name is Elizabeth Polsin. I also want to thank SAGES for letting me present this project, Small Bowel Obstruction, Does Timing of Resumption of Diet Matter? Oops. I had no disclosure, sorry, I skipped that slide. I have a quick disclaimer. I am through an HCA healthcare residency, but HCA healthcare does not necessarily have these same point of views. Am I not pushing the right button?
Is there a clicker up there with like a green arrow?
Yes.
My test mouse on the screen.
Okay, here we go. So small bowel obstruction, as we know, is a common clinical condition for which general surgeons are often involved. Up to 15% of hospital admissions in the U.S. are due to small bowel obstruction, and non-surgical management is utilized in a majority of these patients. Length of stay for these patients, on average, can be about 2 to 14 days, and this was the main outcome that we looked at in our study. Most clinicians wait for passage of flatus or bowel movement as kind of the sign of resolution of small bowel obstruction and therefore allow their patient to initiate a diet. But there are no studies that analyze when to resume a diet based on flatus or passing of bowel movement. So our study aims to answer that question. When should we resume diet following small bowel obstruction resolution? After flatus or after a bowel movement? And as I mentioned, the most commonly reported outcome in small bowel obstruction research is the hospital length of stay. This was a multi-center retrospective cohort study within HCA hospitals, 179 of them. And this looked at patients admitted for small bowel obstruction that were managed non-operatively. We started with around 70,000 patients between January 2016 and November 2020, and 16,000 patients were included in our final analysis. Patients were excluded if they did not have complete chart data, like no bowel movement or flatus was documented. And we also excluded surgical patients. We wanted to take off any variables included in surgery. So we ended up with these two bowel movement first groups and the flatus first group. These were analyzed based on resumption of diet after first passing flatus or after having a bowel movement. We looked at length of stay, both total hospital length of stay and post-diet resumption length of stay. These first two graphs here show demographic data for our patients. There were no differences between our two groups, either in age, race, sex, and then in the different comorbidities as well. We also looked at payer type and admission source, like from a facility or from home, and didn't find differences between the groups. So here's the meat of our study: time after admission until first bowel movement, first flatus, and first meal. So in our bowel movement first group, or the late diet group, they had their first bowel movement at 28 hours, and first meal was initiated at 55 hours. Compared to our flatus first group, they passed flatus at around 16 hours, were able to have a meal at 35 hours, and then later had their bowel movement at 47 hours. So we used the negative binomial regression and evaluated length of stay based on their diet resumption. And the flatus first versus bowel movement first, their incidence rate ratio was 0.8, meaning that the length of stay for these patients was 0.8 times the length of stay for the bowel movement first group. Or to interpret that in the reverse, the bowel movement first group had a 1.25 length of stay compared to the flatus first. We also looked at length of stay after resuming a diet, and the flatus first group had a shorter length of stay here as well. So a few limitations of this study. As I mentioned, we only looked at patients who are managed non-operatively. This is the majority of patients that are admitted with small bowel obstruction, and as I mentioned, we took out the surgical variables for better internal validity. And we did not compare or standardize the treatment strategy for patients that were undergoing small bowel obstruction management. So we didn't look at small bowel follow-throughs or NGT compression in these patients. Our study does address whether there's a benefit to resuming diet earlier or later. And our results show that patients who resume diet after passing flatus have a decreased hospital length of stay and post-diet length of stay. So thank you very much.